So imagine this, a disease, right, affecting hundreds of millions of people globally, and it's responsible for, well, over 1 million deaths each year. And get this, that number, it's actually rising. But here's the really perplexing part. We have accurate tests, effective treatments, even a highly effective vaccine. Yet, this disease is still a massive global health crisis. It's almost baffling, isn't it? Like we have all the pieces, the tests, the treatments, the vaccine, but the puzzle isn't coming together and people are still dying. Welcome to the deep dive. Today we're going deep on viral hepatitis, essentially, and inflammation of the liver from a virus. We'll mainly focus on hepatitis B and C. Our sources for this exploration, they come straight from the World Hepatitis Alliance, specifically their home World Hepatitis Day materials. Okay, so our mission today is to figure out why. Why, when we have these solutions ready to go, is the world actually, struggling to eliminate this preventable disease? What are the real roadblocks here? By the end of our chat, you'll have a much clearer picture of these often hidden challenges and just how critical awareness really is.
Let's kick off with the scale. I mean, this thing is often called a silent killer for a reason. The sources point out something pretty astonishing. After COVID-19, hepatitis is the world's deadliest virus. And like I said, over 1 million deaths every single year. And yeah, that number is increasing. Tragically, it's a crisis, but maybe one that's not always in the headlines.
Yeah, the scale is just immense. And beyond those million-plus deaths annually, the data shows over 2 million new cases pop up every year. And right now, over 300 million people are living with hepatitis globally. And it's not just about the virus itself, it's also the leading cause of liver cancer. It's huge.
Right. And that phrase in the source material, the world is moving backwards, that's just, well, it's infuriating, isn't it?
Yeah.
Especially when you think about the goal to eliminate hepatitis by 2030. So if we're actually going backwards, what does that really tell us? Is it like a failure of the science, or is it something more complicated?
That's exactly the question. And what the sources really highlight is that it's less about a gap in the science and much more about these deep-seated human and societal factors.
Right.
The critical barriers they identify aren't about needing new medical breakthroughs. No, it's things like low awareness, which means, loads of people just never even think about getting tested. Then there's widespread misinformation. Think about harmful fake cures people might find online. Plus, these persistent myths that stop people seeking proper help, and this really pervasive stigma. That stigma forces people to kind of suffer in silence instead of reaching out for the services that do exist. And the World Hepatitis Alliance is pretty clear on this. These are the things really holding us back from getting to a hepatitis-free world. They explain how these factors, awareness, stigma, misinformation, they directly lead to a lack of decisive action from, say, policymakers. And that ultimately stops people from accessing the vital hepatitis services that we actually have available.
Okay, so it's these non-medical barriers, awareness, stigma, myths. Got it. But the real punch of these challenges and how unevenly they hit different parts of the world, that becomes super clear when you look at the regional numbers, right?
Oh, absolutely. The disparities are stark. They really show the human cost of these barriers. Let's take Africa, for instance. It carries something like 63% of all new global Hep B infections, a huge burden. But diagnosis rates, shockingly low. Just 4% for Hep B, maybe 13% for Hep C. And treatment, even worse. For Hep B, it's hovering around a staggering 0.2%. The source really stresses that fewer than 1 in 10 people in Africa can actually access these life-saving interventions, even though they exist. Now compare that maybe to the Western Pacific. That region actually has the highest annual death toll, about 561,000 deaths. You've got nearly 97 million people living with Hep B there. Diagnosis is better, around 26%, but treatment still lagging, less than 6%. And even if you look at places like the Americas or Europe, where the overall death tolls might be lower, the pattern is still there. Millions living with the virus, but just shockingly low percentages getting diagnosed or treated. It really points to this global disconnect between having the solutions and getting them to the people who need them.
Wow. That is, yeah, that's a sobering picture. Looking at those huge gaps, those millions of undiagnosed people, you might immediately jump to thinking, okay, it's just funding, right? Or maybe not enough clinics. But the sources seem to be saying the core issues are more fundamental. They're rooted back in those human factors we talked about, awareness, stigma.
Yeah.
So it's not just the sheer number of cases, it's also this terrible story of inequality in accessing even basic help.
Precisely. The numbers are really just symptoms, aren't they? Symptoms of those deeper human and systemic issues. And that's why the World Hepatitis Alliance isn't just, listing the problems. They're also mapping out a clear path forward, a path to elimination by 2030, which kind of brings the focus back to what's possible, what we can actually do.
Okay, so what does that path look like? What does this mean for us, as a global community?
Well, the core goals are pretty straightforward, really. First, making sure everyone has the knowledge they need. Knowledge to make informed choices about getting tested, getting treated, getting vaccinated. This means fighting that misinformation head on. Second, getting decision makers on board, turning them into advocates, making sure they allocate the necessary resources, basically turning awareness into policy action. Third, tackling that stigma, ending it, making sure no one gets left behind because they're afraid or feel judged. And finally, just fostering the belief, the real belief, that eliminating hepatitis isn't just some far off dream, it's achievable. We can do it with collective action. And that's why World Hepatitis Day, every year on July 28th, is so important. It's designed as this key moment to bring everyone together, raise that crucial awareness, and actually push for real change.
And that brings it right back to you listening right now. Just understanding these facts,
Yeah.
recognizing these often hidden barriers, that's step one, isn't it? It's the crucial first step towards being part of the solution, however small your contribution might feel. So as we wrap up this deep dive, let's just quickly circle back to that central challenge, that paradox of hepatitis. It's preventable, it's treatable, yet it still claims over 1 million lives every year, mostly because of these non-medical hurdles like misinformation and stigma.
Yeah, and if you zoom out a bit, connected to the bigger picture, it really makes you ask some important questions, doesn't it? Questions about how we as a global society decide what to prioritize, how we act on health crises that we know are preventable. The fight against hepatitis mirrors these broader challenges in public health everywhere. The power of working together against bad information and prejudice.
Yeah.
And just the urgent need to make sure everyone has fair access to the solutions we already have, even when they seem readily available on paper.
So here's something for you to maybe mull over after this. Considering we genuinely have the tools to eliminate hepatitis by 2030, and knowing that raising awareness and breaking down stigma are absolutely key, what's maybe one small way you could help shift the story or just increase understanding, maybe even just in your own community or circle? Thank you for joining us on this deep dive.